Well, I'm Dr. Steve Dullard. I'm the owner of Ancare Veterinary Hospital, and this is my dog, Olivia. No, Olivia's the daughter my wife never had. I have 2 sons, but she's pretty much got us wrapped around her finger now because my sons are out of the house, and so we're empty nesters, as far as that. But she's a Havanese, and she's 4 years old, and she pretty much has most of my staff wrapped around her paw also. We're a full service hospital, so we do soft tissue surgery, we do dentistry, we do orthopedics, internal medicine, general practice. We try to be the Mayo Clinic of veterinary medicine. You come here, we get the problem figured out. First came up with our core values. We came out with a big list of different things, and then we said we had to narrow this down. So we came up with an acronym called PACO Pecan, and we've got a picture of it up on the wall of our core values that we believe in. When I graduated from Iowa State, I was the youngest person in my class, and I was only 24 years old when I became a veterinarian. So I've been a veterinarian now for 39 years, and I can tell you right now, after 39 years, I still love being a veterinarian. Our reputation is very well regarded as far as in all North Central Illinois. We've been voted the #1 hospital for the last 3-4 years in a row. And I think it's just because we keep our eye on the ball of what's really important to people. So we've always been very much kind of like a teaching hospital also, working with the certified vet techs. And then now I'm in about my 7th, 8th year for an extern program for veterinary students. So we try to make this very much a learning, hands-on type of environment. It's funny, they'll say, well, we're told this, and some of the stuff, I'm like, that's good. They're teaching you the gold standard, but have they ever taught you to think about this, this, and this also? And a lot of times it's like, oh, never even had to think about that. And the difference is you're getting a lot of theory when you're in veterinary school or in tech school, but then when you get out and practice, you've got to take that theory and put it into practice. And so, I learn a lot from the students too. They may give me a tidbit that I hadn't thought about, or maybe I dismissed it in the past, but technological changes occur, things change, trends change, and you're like, you know what? Let's go ahead and let's incorporate that now into what we do. It's just part of evolving and having a good practice and listening to what your clients want and listening to what your staff wants. One of my biggest things is as a mentor to students is that you have no idea what you're capable of unless you believe you can do it. And if you believe you can do it, and then you take the right steps in order to get yourself so you know that you're competent, that you can do it, it just opens up so many avenues for you in veterinary medicine. So our typical day is usually what we try and do is we usually do surgery Mondays through Thursdays. We have, like for me, Tuesdays and Thursdays are really big surgery days. And then what we'll do a lot of times is in the afternoons, or if it's a day in which you're not doing surgery, like it's internal medicine and wellness exams, things like that. So one of the things is when we started our extern program, I know that you do not get enough surgery experience in the vet schools. We had junior surgery labs when I was in college. They got rid of that in a lot of the schools. Now they're trying to bring it back. Well, we've got an agreement with our local humane society that my externs are going to be the ones that are going to be doing the spays and neuters. So when you come to our practice, you get the opportunity to do a lot of spays and neuters as far as on dogs and cats. And then of course you're going to get a scrub in with us with all the other surgeries that we do. I've got one extern right now who she's like, oh my gosh, I never knew I was going to do so much orthopedics, and she's done 3 knee surgeries with me while she's been here, and plus her spays and neuters, and we've done a lot of advanced dentistry type things. And so I think she feels pretty confident as far as knowing how to do some of these dental procedures and some of these other things we do. So it's definitely a hands-on program. The technicians and my whole staff, we're all totally on the same page when it comes to externs. And so we're like, okay, it's your turn. Watching is the easy, doing is the hard part. And if you want to come to a practice where you're going to get a do, then this is the place you need to come to, because it's how you really learn. You got to struggle through that part, and until you do that, you are just watching.